I'm Dr. Amy Nassimran, and this is Divergent Minds. Welcome back. Today we're talking about a topic that I've been hearing more and more questions about lately as a psychologist: how to spot ADHD in childhood. I am so excited to dive into this with you. It's a question that has been coming up more often, especially in the past few years or so. I've been seeing more parents in my office, especially parents of young children, even as young as 4 or 5 years old, who are asking about this. And it can be hard to tell sometimes, especially when kids are that young. So if it's something that you've been wondering about too, you're definitely not alone. I am excited to talk through it with you. For my fellow busy brains out there tuning in, the TLDL, too long didn't listen, of this episode is that ADHD can be tricky to spot. When people think about ADHD in kids, commonly the first thoughts that come to mind are of a child who is hyper or distracted, but ADHD is not just that. Some signs of ADHD can be surprisingly subtle or misunderstood, or even missed altogether, especially in certain kids, which we'll talk about. So if this sounds interesting to you and you're curious to learn more, I hope you'll stick around. So here's what we're going to be talking about today: what ADHD is and what it isn't. We'll go over some common signs to look out for in kids, the more subtle signs that I mentioned that can be overlooked, how ADHD can show up differently in girls compared to boys, which is interesting. And then we'll talk about some steps that you can take if you're seeing signs of ADHD in your child. So first, let's start with what ADHD is really, because before we get into the signs, which I know is probably the part you came for, it helps to understand what ADHD is, and I also want to clear up what it isn't. So ADHD stands for Attention Deficit Hyperactivity Disorder, and it's one of the most common neurodiverse conditions diagnosed in kids. As of today, in 2025, we're looking at about 7 million children in the US with an ADHD diagnosis, according to the latest data. And based on my experience as a psychologist, my guess is that this number will probably continue to grow. So ADHD is a very common neurodiverse childhood condition. But here's the thing. Even with the rising rates and increased awareness of ADHD, it's still misunderstood a lot of the time. Not all attention issues are going to be indicative of ADHD, and not all ADHD looks the same. Sometimes ADHD is misidentified or even completely overlooked in certain kids, which we'll get to. So on one hand, in my experience, the increasing rates of ADHD have come with much more awareness and a greater acceptance of ADHD as a society. I've seen the stigma around ADHD soften a little bit, especially with the flood of content that we're seeing about ADHD on social media. Lots more people are talking about it. Lots more people are aware of it. So there tends to be an overall greater acceptance of it as well. On the other hand, with that has also come a rise in oversimplified stereotypes about ADHD. And sometimes I've seen straight up misinformation. The signs of ADHD don't always match the stereotypes about it. I mentioned that ADHD is not just about being hyper or bouncing off the walls or distracted. Also, I mentioned that not all attention problems are ADHD. A child who has difficulty focusing in class doesn't automatically mean that they have ADHD. I've worked with many children who look like this, but let's say they're actually so anxious or so worried about something that it's manifesting in the classroom as distractibility. Another example of this might be a child with a learning disability who becomes distractible during a subject that they're struggling to learn. So here's what ADHD is. At its core, ADHD is a brain difference that affects how a child's brain develops and works. The parts of the brain that are responsible for things like managing attention, focus, impulse control, problem solving, even time perception in a brain with ADHD work differently. Sometimes these kids with ADHD get labeled as lazy or unmotivated. Or a common one that I might hear is they're not trying hard enough, when in reality, it's that their brains are wired differently. So ADHD is not laziness. It is not caused by eating too much sugar or getting too much screen time, although that is an issue that is maybe a conversation for another day. Um, ADHD is definitely not just a phase. It is not something that children will grow out of. It is not your child being bad on purpose. And most definitely, it is not a reflection of bad parenting. I also want to call out that even though attention deficit is literally in the name, ADHD is not always about a deficit in attention. I hope they change the name at some point because ADHD isn't always about not having enough attention. Actually, many of my clients with ADHD can focus really well and sometimes even too well. Maybe you've even seen this, especially on things that interest them. Maybe you've seen a child who gets really, really into an activity or a movie, or screens, as I mentioned, are a popular favorite. And they can get so into it and they can focus on it for hours at a time. So then when it becomes time to switch away from it, they actually have difficulty shifting their focus off. So some kids might even show their difficulty with this. They might whine, they might negotiate for more time, drag their feet, even have a tantrum. So ADHD is, definitely not always a deficit in attention. Sometimes it can involve this hyper focus. It's how a lot of people with ADHD might describe it. I've had some clients describe it as both a blessing and a curse. They have this ability to pay such intense attention to something that interests them that it can lead to losing track of time because they became so focused on it. So instead of a deficit in attention, even though it's in the name, I usually try to explain that ADHD is more about a difference or a difficulty in managing or regulating attention. Okay, so now that you know what ADHD is and we've talked about what it isn't, let's break down what ADHD can actually look like in kids. Keep in mind as we go through the signs that ADHD can show up differently in different children. No two kids are exactly the same, and even two kids with ADHD can be quite different from each other and have different experiences. So, something you might already know, as we understand it today, there are three types of ADHD. And the common signs of ADHD tend to map onto these types. So, the first type of ADHD is the hyperactive impulsive type. This is probably the image that comes to mind first when most people hear about ADHD. Some signs of a child with the hyperactive impulsive type might be running or climbing a lot. You might see this at home, climbing on furniture, or busy hands or busy bodies while you're out at the store. Talking nonstop is a phrase I hear a lot from parents of kids with ADHD. Or they'll say they can't ever get a word in with their child, or their child is blurting out answers sometimes before the question is finished being asked. Another sign might be difficulty waiting for things like waiting for a snack that they've asked for or waiting for their turn. This can be a really frustrating experience for them. Or another sign might be a child who feels like they're always on the go or who looks like they're always on the go. They have a motor that doesn't ever stop. I've had more than one parent describe their child to me as like the Energizer Bunny, for example. Then the second type of ADHD is called the inattentive type. In this type, the main characteristics are more related to attention. So something like a child who moves very quickly from one activity to the next, Kids with inattentive type might not usually stick with any one activity for very long. Or sometimes they might appear like they're tuning out or not listening when they're spoken to. They might forget instructions. Or daily routines is such a common one. The parents that I work with get really confused by this because it's like their child is asked to do the same routine, and the routine contains the same exact steps day after day. So you can think of a morning routine, for example, where you first brush your teeth, and then you put your clothes on, and then you grab your backpack, right? It's the same every day. But kids with the inattentive type might struggle through a routine like this. They might have trouble remembering the steps, even though it's done day after day. Um, Another sign might be often losing things. Think about lunch boxes, gloves that go to school and don't get sent home or don't come home, homework, toys, books, things like that. Um, Trouble following through on instructions or finishing tasks, or being easily distracted by things in their environment. So this might be, easily distracted by something like noise, different sights, sometimes even their own thoughts. And then finally, the third type of ADHD is called the combined type. So this is when a child shows signs from both categories, both hyperactivity and inattention. A child with the combined type of ADHD might have high energy levels and difficulty focusing on certain tasks. So imagine a 6-year-old who jumps from activity to activity and then needs reminders to be repeated multiple times before they complete a task. Or it might look like a child who appears to be daydreaming a lot of the time, but then can also be very talkative. Sometimes they're blurting out answers in class, or as I mentioned earlier, you might have trouble getting a word in when you're talking with them. So I'm curious if some of this is starting to sound pretty familiar to you. You might be nodding along and picturing your own child or another child that you know. But if not, I did mention that not every child with ADHD has energy levels like the Energizer Bunny, or is talking nonstop, or looks like they're always on the go. These kids do tend to be spotted and then sometimes diagnosed earlier because the signs that they're showing are by nature more noticeable. They're what I call the louder signs because they're quicker to catch our attention. They're a lot harder to miss. And quite frankly, some of these signs might manifest in certain behaviors that can be more bothersome to parents and other adults, especially when it's something that's happening on a daily basis. So, understandably, parents feel more urgency to ask for help or to get a professional's eyes on it. However, I mentioned sometimes that signs of ADHD can be subtle or they can be missed altogether. And these are what I consider to be the more quiet signs of ADHD. The quiet signs of ADHD can sometimes fly under the radar because they're less likely to catch our attention. They're not as loud, so to speak, and so they're easier to miss. The inattentive signs of ADHD can sometimes be harder to spot. So, for example, you might have a child who seems to zone out or be daydreaming a lot, who might take longer to get through their homework or certain tasks, or becomes more easily distracted, but they're not disrupting anything. They're not disrupting home life, they're not disrupting the classroom. Here's something important. So girls tend to show more of these inattentive or the quieter signs. And this is one of the reasons why ADHD can actually go undetected in girls sometimes, or why we're seeing more women who weren't diagnosed until later in life. Right now, boys are twice as likely to be diagnosed with ADHD. And part of this reason is because girls are tending to show more of the inattentive symptoms that are easier to miss. For example, even though they might be distracted easily by the environment or they might be struggling to pay attention in class, this isn't usually disrupting the flow of the classroom, like a child who's showing signs such as answering a question before it's finished being asked or having trouble staying in their seat or fidgeting a lot, right? So it's less likely to be noticed or flagged by teachers and parents. There is research to show that girls are also more likely to mask, meaning that they are trying to suppress or hide their struggles or their symptoms in order to fit in socially. So, with girls, when it comes to girls, sometimes ADHD isn't noticed until later in life when it becomes much harder to mask or suppress, like in their teenage years or even sometimes until adulthood. Okay, and then in addition to the inattentive symptoms of ADHD that I mentioned can be quieter or more likely to fly under the radar, I wanted to share with you a few patterns that I've seen again and again in my work. So these aren't signs that are necessarily specific criteria of ADHD. You're not going to find these in a symptom checklist necessarily or in the diagnostic manual, but these are things that I've heard about over and over again based on my, almost 20 years of working with neurodivergent kids and parents. So let me share a few patterns that I've seen again and again in my work. Again, things that don't always show up in diagnostic checklists, and they're not necessarily characteristic of ADHD, but they have come up often for kids with ADHD that I've worked with. So, first is emotions. Most kids can have big emotions from time to time, and this is because developmentally, kids' brains aren't equipped to regulate their emotions very well yet. But kids with ADHD often feel their emotions more intensely or more frequently, and they might have a harder time regulating them because of this. The parents that I've worked with have sometimes described that their child's tantrums can last for a while, for example, or they have a child with ADHD whose emotions go quickly from 0 to 100. Um, on the flip side of this, though, is that these kids do tend to be incredibly empathetic or compassionate or perceptive of others' feelings and needs. They can also be quick learners when it comes to emotional learning. So, two sides of the coin here. The next thing that I wanted to talk about is sleep. So, again, sleep issues are not a specific criteria of ADHD, but almost all parents that I've worked with have brought sleep up as an issue. So, many parents have said that their child has had trouble sleeping since they were a baby, even before we knew that the child had ADHD. A really important example comes out and sticks with me. A parent recently told me that their child hasn't slept in 4 years, and this child is 4 years old. So sleep has been a challenge for them since birth. And then the last tidbit I'll say here is that for kids with ADHD, development can look uneven sometimes or different, which remember is not inherently a bad thing. But the developmental trajectory that sometimes kids with ADHD follow can look different when compared to the expected timeline. So, for example, many kids with ADHD can show advanced or early development with some skills. Sometimes parents talk about their kids being early walkers, or maybe a child maybe even skipped crawling and went straight to walking and then climbing and running. Um, Kids with ADHD can also be highly intelligent. So maybe they excel in certain areas like reading early or learning numbers quickly, but then they struggle with other things like remembering to grab their coat or following the steps of a morning routine, like I mentioned. And I think, the mismatch here can be really confusing and I think at times easy to misinterpret as the child's not trying hard enough when really, as we talked about, their brains are just developing differently. And that doesn't necessarily mean that something is wrong. It's more about being able to acknowledge and understand this difference, that it's a part of their neurodivergence, so that we can support them by meeting them where they're at instead of pushing them to meet the standard expectations. So now you might be listening to all of this and wondering, well, aren't a lot of these signs and behaviors just typical kid stuff? All kids have energy at times. Their attention spans are shorter in general. And like all of us, every child will have trouble focusing sometimes too, especially on things that they think are boring. And that's why it can be challenging to spot and diagnose ADHD in children because some signs associated with ADHD are also common behaviors of kids in general. So, a key difference comes down to degree and impact. With ADHD, these things become even more true. These signs might happen more frequently, they tend to be more ongoing or last longer, and they have a greater impact on kids. It can start to affect different areas of their life, like their learning at school, their friendships, and even affect family life. So let's talk about what you can do if you're seeing signs of ADHD in your child or a child that you know. As a first step, a good starting point is going to be your child's pediatrician. So you can talk to your child's pediatrician about what you're noticing, any behaviors or patterns that you've observed. Share your concerns here. Ask the pediatrician to do an ADHD screening. And here's a pro tip because I think that, knowing what to ask for can make a really big difference in terms of getting the right support. So if you want to just pause here and grab a pen or open up your notes app on your phone to jot this down, um, ask your pediatrician to administer the Vanderbilt. So the full name of the screener is the Vanderbilt ADHD Diagnostic Rating Scales. The Vanderbilt is a great quality screener. It screens for both hyperactive, impulsive, and inattentive symptoms. It's going to ask you questions about how your child is doing in different settings, like at home and at school, which actually is a really important piece for accurate assessment. And it's also going to do an initial screen of other conditions like anxiety and depression. So the Vanderbilt is my recommendation screener. It's very commonly used, especially to screen for ADHD. It's used often in pediatric practices, but if for some reason your pediatrician doesn't have access to specifically the Vanderbilt, then a good alternative would be the SNAP 4. So you can request that one as well. Just a note here, I wanted to call out that a screener alone won't be able to give your child a diagnosis. So a screener cannot diagnose. It is a starting point. It can help you make an informed decision about whether digging deeper is warranted, which if it is, the next step would then be to consider a comprehensive evaluation for ADHD. That's going to be a bigger commitment with both time and financially, but it is important for getting an accurate look at what might be going on and an accurate diagnosis. Next, I recommend talking to your child's teachers. Teachers are with your child in a very uniquely structured environment. They see your child, almost every day of the week. And so their insight into how your child is doing with things like following classroom directions, staying focused on tasks, staying seated, and handling classroom expectations and routines is going to be such a valuable and key piece of information here. An important point here is that schools cannot diagnose ADHD. So, schools do evaluations, and evaluations that are done at school are to see if your child qualifies for school based special education services. A child can be found eligible for services at school, and the school would probably then assign a certain category to your child, but schools can't and don't diagnose. Regardless of this, a teacher's observations can be really important, though, when it comes to understanding and diagnosing ADHD in a child. So then at this point, if you, your child's pediatrician, and or your child's teacher are noticing consistent patterns or concerns, or maybe, your gut is just telling you that something is up, you might want to consider a comprehensive evaluation with a psychologist or a neuropsychologist. So, the thing about a comprehensive evaluation is that it is a much more in depth process than a screener. It usually involves getting a variety of information from a variety of sources and informants to truly understand the full picture of what's going on with a child and not just focusing on their problems or their symptoms. It would likely involve interviews or questionnaires with the important adults in a child's life, like you as a parent or your child's teacher, to get a better picture of how your child is doing across different settings, like I mentioned. Um, and then it will likely involve direct testing with your child to take a closer look at their skills. So, a comprehensive evaluation for ADHD might be testing for skills like their attention, of course, and their memory. Their impulse control might be one, and their executive functioning overall, which, if you're not familiar with what that is, it's just a fancy term for thinking skills. For example, how a child plans steps or problem solves. Some families do go straight to this step to seek a comprehensive evaluation. This tends to happen if they're seeing pretty clear signs off the bat or they want to get that full picture. Other families start with a screener and then use that information to help them decide from there. So, either way, I know this is a lot to digest and to think about. So, I encourage you to go at your own pace. If you're curious more about the diagnostic process and what that comprehensive evaluation looks like, I do go into more detail about this in episode 2. So feel free to check that one out next if you'd like. All right. So I know that was a lot of information, but here is something I always tell families. You don't need a formal diagnosis to start supporting your child today. If you are noticing some of the signs that we talked about, I don't want you to panic and I don't want you to feel pressured to act right away. You can maybe start to think about reaching out to the pediatrician or the teacher, but there are also things that you can start doing today that can make a meaningful difference for your child. And maybe you're even already doing some of these things. So remember that I know that you are doing your best here. So, these strategies that you can do today to support your child who might be showing signs of ADHD are not just helpful for kids who have ADHD. They're actually great practices for many kids in general, given their developmental level. But they can be especially helpful for kids with ADHD like traits. So, some of my favorites are things like creating really consistent routines. Kids with ADHD and kids in general tend to really thrive on structure. So, tools like a visual schedule, step by step checklists, even pictures to help show them what a morning routine or the steps of a morning routine could look like could serve as really helpful reminders to help kids stay on track. Another strategy is to break tasks down into smaller steps. So, I'll give you an example. A really big task or a common task that we are asking of our children is to pick up your room. And that's a really big task that can feel overwhelming for a lot of kids. And so trying smaller steps like first put the books back on the shelf, right? Or put this pile of Legos back in the box might feel a little bit more doable. Building in movement breaks can be really helpful. Encouraging kids to move their bodies throughout the day can help them really regulate that level of energy that can then help them focus better afterwards. Whether it's jumping on a trampoline, dancing to music, doing kid yoga, even going for a quick walk or walking the dog can help. And then, most importantly, is positive reinforcement. Don't forget to cheer your child on along the way. Praise and acknowledge when they complete the smaller steps of a bigger task, or when you notice their efforts. Positive reinforcement can go such a long way to boosting kids' motivation. It boosts their self esteem. And when they're motivated, when they're feeling great, these are things that can help carry them through the tougher and more stressful moments. So, these might sound like pretty small things, but some of these shifts can make a big difference in the way that we support kids with attention differences and ADHD traits and the unique ways that their brains work. All right, so to recap how to spot ADHD in childhood, ADHD isn't always loud or obvious. Sometimes it can look like high energy or quick spontaneous actions, but some signs of ADHD are actually more subtle, like forgetfulness or tuning out in a conversation, and these signs can be easily missed, especially in girls. Here's your 2-minute takeaway or tip for today. Something that you can do with all of the information that we talked about today in 2 minutes or less. If you're wondering about your own child or a student or another child you know, jot down the Vanderbilt screener to ask the pediatrician about, or start an email draft to ask your child's teacher about what they're seeing in the classroom. Or if you're not ready for that yet, choose one of the support strategies that we discussed, like coming up with pictures or using visual reminders, or maybe you set an intention to use more positive words of reinforcement throughout the week. I hope this episode gave you a little more clarity or at least a starting point. Whether you're at the beginning of this journey or somewhere in the middle, just know that you're not alone and there is support out there, both for you and your child. If you're curious to dive deeper into evaluation options or strategies for supporting neurodivergent kids, come check out episodes 2 and 3, where we'll talk more in depth about the diagnostic evaluation process and strategies for support. Thanks for spending time with me today. Once again, I'm Dr. Amy Nassimran. Let's keep the conversation going in the next episode. See you there. This audio series is brought to you by Modern Health. The topics presented in this series are intended for informational purposes only and should not be considered a replacement for medical or mental health advice, diagnosis, or treatment.